to me, life is not just about living, it's about thriving. Now I get a lot of referrals from psychiatrists in my area who send me patients. So yes, anxiety, depression, low mood can be a symptom of low testosterone. So if you are a man or woman suffering from those symptoms, make sure you check your numbers. You may be surprised to see what TRT can do for you.
One of the questions we get asked a lot is, how do you know that you need to be on testosterone replacement therapy? So yeah, Rudy, real quick, what have you thought of or what have?
That's a very important question. And most people and most doctors will tell you it's based on the blood level. If your testosterone is less than 300, you need testosterone therapy. My approach is different. Yes, we need the number, but the symptoms are the most important. And I usually base my symptoms in 3 different areas. And I ask my patients to do a self-inquiry. Ask yourself, how's your physical energy? How's your mental energy? How's your sexual energy? And give yourself a score from 1 to 10. So physical energy. Are you tired? Do you need naps during the day? Is your body composition, you're not happy with it? More muscle, you're losing muscle mass and you're gaining body fat. From 1 to 10, where would you rate yourself? Number 2 would be mental energy, from 1 to 10. Do you have depression or mood swing? What I call blah mood, feeling like everything is kind of darker around you. Do you have decreased motivation? That's a big one. So you give yourself a score from 1 to 10 on the mental energy. And next one is sexual energy. Whether you have decreased libido, decreased strength of erection, decreased reliability of erection. How many times, if you have tried to have sex 10 times, how many times can you have a strong enough erection to finish the task? Now you get yourself a score from 1 to 10 on those 3 areas. And I get a lot of patients who come to me as a 2, a 3 out of 10 in those areas. But I get also patients who come at a 6 or a 7. If you're 6 or a 7 and your testosterone level is 300, 350, you're feeling pretty good. But could you be an 8? Could you be a 9? Yeah. Right? Could you be even better than where you are? To me, life is not just about living, it's about thriving.
Absolutely. But also not just the total testosterone, that's just one measure, is the free testosterone as well, because we have some men who unfortunately will have, the bodies are producing a good amount of total testosterone, but they have all the symptoms of low testosterone because they have high sex hormone binding globulin and a low free testosterone.
You want to check the levels, total, free testosterone, and SHBG, and look at your symptoms. You put all of those together, because I have patients who come to me at levels of 500, and they have a score of 2 to 3 on their symptoms. This patient may have partial androgen insensitivity syndrome. I've seen quite a few patients with this. On the opposite, I have patients who come to me at levels of 300, 350, but they feel pretty good. They are 6, 7, or 8. So it's not the simple answer. So that's why if you want to answer that question, you need to talk to a provider that really understands it. It's not just the number. You want to put the numbers with the symptoms.
Absolutely. And one of the things that we do in the UK, because I know in the US you have access to LC mass spec free testosterone assays, we find the more reliable data is from using calculated free testosterone, where we look at total testosterone, SHBG, albumin, and calculate out the free testosterone, because that's what they do in most of the peer-reviewed studies to calculate the free testosterone. And that's what we do at Balance Our Hormones, because we don't have full access to it. And even that mass spec full testosterone may have certain errors that skew the results. So sometimes people will think they have a higher free testosterone than they actually do.
And that's where, again, symptoms and symptoms resolution. Somebody scored 4 or 5 out of those 3 areas. I will do what I call a therapeutic testosterone trial, because it's an off-label use that I can. But I've seen many patients that they feel better when their testosterone is in the upper limit, 1,000, 1,200, 1,400. And we know that those levels are not dangerous for you. But to me, it's symptoms resolution. How are you feeling? And
testosterone levels affect mood and mental health.
So one of the most important things for me is the benefits of testosterone to the brain. So testosterone does affect mood and health. Actually, testosterone does modulate the serotonin receptor. So many patients with anxiety or depression, at the end of the day, it was low T. So now I get a lot of referrals from psychiatrists in my area who send me patients. So yes, anxiety, depression, low mood can be a symptom of low testosterone. So if you're a man or woman suffering from those symptoms, make sure you check your numbers. You may be surprised to see what TRT can do for you.
So what are some of the side effects that you've seen from testosterone treatment?
So testosterone overall has been shown to be pretty safe, especially when we do it at the levels, the testosterone replacement levels that we're doing. Things that we see sometimes in the beginning, some patients may experience a little bit of water retention. Sometimes acne can come out. Those are the main things that we see. Sometimes there are some patients in the beginning that may see maybe a little bit of being a little more irritable, a little aggression, a little more. So when I do my follow-up with my patients, I go for all of those with them and we adjust the doses. As far as long-term side effects with testosterone, it's been proven to be pretty safe. We have the study now.
The
We're talking about the Traverse trial. It's not a perfect study, but at least it lets us know that the worry about cardiovascular side effects of testosterone are not what we used to think. So overall, testosterone, when done properly to the right patient, is mostly positive.
Right. Here's one we talked about it earlier, came from one of our comments. One of the patients had said they would love to start testosterone treatment, or he's on blood pressure medications and is worried that testosterone may increase his blood pressure. What do you think?
So testosterone in some patients may cause some water retention, and you may see a transient increase in blood pressure. So I ask all my patients to always monitor their levels. But having high blood pressure is not a contraindication of starting testosterone therapy. You make sure that you monitor it the right way. And in most cases, what we see with patients, by the time that they've lost weight, gained lean muscle mass with the testosterone peak, the long term, 6 months, 9 months, you see blood pressure goes down. So it is not a contraindication. It can be helped. It needs to be followed. On patients like this, I always use the right supplements, including magnesium, nitric oxide, to make sure that the blood pressure is not an issue.
I mean, not to mention people with low testosterone may also suffer from high blood pressure, and those two could be linked, as well as this particular patient who is already on blood pressure medications. He should be under control rather than someone who doesn't have blood pressure medications will be under that same level of control.
So it's not a contraindication, but you need to be sure that you
monitor it regardless. Okay. Well, that's actually the thing too, transient blood pressure. I mean, if you exercise and lift weights, you get a transient spike in blood pressure. Is that to be feared, or is it just something that you know?
Yeah, so many things can spike your blood pressure. Caffeine can spike your blood pressure.
But it's really the long-term elevation of blood pressure that's the problem, not a transient, because if we all had just low levels all the time, I mean, we wouldn't get anything done. You have to walk, your blood pressure might go up a little bit. You're standing or sitting, the blood pressure goes up. But there's a lot to worry about it because, long-term chronic blood pressure can be very damaging. How does age affect testosterone levels? I know you're seeing younger and younger patients having low testosterone, but overall, how does age affect the testosterone
So
levels?
when I went to medical school, we only recognize late onset hypogonadism, meaning that men will lose their testosterone as we age. And after the age of 30, we lose about 1% of our testosterone per year. So as you get older, it's expected that you lose more testosterone. Not everybody. But what we've been saying right now, and especially this epidemic of low testosterone that we're seeing, is completely different than anything we've seen in medicine. Right now, I have patients in their teens, their 20s with testosterone in the 200 range. And yes, obesity epidemic plays a role. We are less active. We're eating junk food. Obesity crisis all plays a role. But what is really important that we need to talk about is the effect of endocrine disrupting chemicals on our testosterone levels. Right now, there was a recent study that showed that they looked at testicular tissue in both humans and animals, and 100% of the testicular tissue had microplastics in it. And microplastic has been plastics in general because of the effect of phthalates mostly. And BPA, there's something called the phthalate syndrome that causes low testosterone. So now we look at the amount of young people coming up with low testosterone, and we're looking at the amount of exposure to those endocrine disrupting chemicals, including microplastic, PFAS, phthalates, BPA, pesticides like glyphosates, atrazine, all that toxic soup of toxins. It is playing a role on that epidemic of low testosterone, and also sperm count has decreased 52% over the past 40 years. And both testosterone production and sperm production on the same HPG axis. Something is affecting our HPG axis.
That's not good. Not good at all. So,
Not good at all.
because how long does it take to see results from testosterone replacement therapy?
So it depends on what we mean by results. And it depends how low you started with your testosterone. So what I see my patients who start at a lower level, they tend to get results quicker. But in general, what I see with my patients, the first thing that you will get it's an increase in mood and in motivation. You usually see that within the first 6 to 8 weeks. You're already seeing some body composition changes within the first 2 months, but you really want to wait till 4 months, 6 months when you're really going to see a lot of the benefits of testosterone replacement therapy. And it all depends also on your lifestyle. If you're eating the right way, you're sleeping, you're exercising, you will see results quicker with your testosterone replacement therapy. Because testosterone replacement therapy should not be seen as an isolated tool. It needs to be done in conjunction with those 3 basics: nutrition, exercise, and sleep. You put those together at our clinic. Once we start testosterone replacement therapy, we do follow-up with me 2 months later, because I expect that at 2 months, my conversation should be a completely different conversation with my patient. So the patient that started with me 2 months prior with symptoms of low motivation, low mood, low sex drive, poor increase belly fat, no drive, 2 months later, they have 60, 80% improvement. So the 2 months, you see some improvement. I tell all my patients, within 6 months, you will see even more.
What's your preference for treatment modalities? Injection and creams? And if it's injections, intramuscular, shallow intramuscular, or subcutaneous?
So this is, again, very patient specific. For example, with me, I've tried many different forms: tablets, cream, and injection. What works best for me, it's injection. Yeah, at our practice, about 60 to 75% of our patients are in injection. We tend to use shallow IM. We use a 0.5 millimeter syringe. And actually, many studies are showing that you don't need to do deep IM injection. Actually, shallow IM or subcutaneous will give you higher levels of free testosterone. But I have quite a few patients on the cream, the 20% cream. We're starting using more testosterone oral. There's even another form of testosterone under canoate that's really good, that patients really... So it's patient preference. I have some patients who are complete needle phobes, who will not do injections, and we may use this. And when you look at testosterone tablets, especially the testosterone under canoate, it does not affect fertility. So if I have a patient who's thinking about still having children or having a problem with their hemoglobin, they tend to be really sensitive to hemoglobin, maybe testosterone oral may be
like a sublingual or
either the sublingual. Now they have an oral form under canoate.
That works the lymph
system, bypasses the liver, it goes to the lymphatic junction. So that's a really good option. But in my practice, and that's different from different doctors, almost 75% of my patients, including myself, will like injections.
Okay. Now there is some bits of, I guess, controversy between sub-Q and IM, and we've seen in our own practice that the sub-Q gives us erratic results. It is almost, the absorption can vary depending on the person, and sometimes it will absorb, sometimes it just sits there. Sometimes you need a higher dose to get a certain result. Have you seen anything similar with your subcutaneous?
So the subcutaneous I'll do mostly with my daily injections, because it's easier. What I don't like with the subcutaneous, a lot of nodules are being formed. It's kind of uncomfortable for my patients. So I like the shallow inch needle.
That's what we do.
To me, that's what I see. I get the best results.
That's what we do. I do myself. I switched to test prop, and I'm doing 3 to 4 hours with shallow IM, and then a couple deeper intramusculars. I've rotated all around. In the UK, the test prop is 1 milliliter. And unlike some, I mean, what's your opinion of the testosterone propionate? Have you thought of it as being a painful injection or?
Yes, we don't use much testosterone propionate in our practice, and we'll use sometimes a triblend, propionate, enantate, and cypionate.
Triblend.
And that usually works really well. I have a few patients, I have maybe 10 patients in my practice, that the only form that does not give them water retention is the propionate. The propionate that we have in the US is very concentrated, so it tends to be a little more
painful. Yes. And that's what we're saying. The testosterone propionate in the UK is a bit more diluted. So you get 25 milligrams in 1 mil, which gives no pain at all. And I've been using it myself for nearly 2 months and finding it works really, really well. And it's not that hard. You don't have that benefit there. So how have you seen testosterone levels impact libido or sexual function?
That's a really important question. So, and we're looking at two different ways, right? Number one is libido. For most of my patients, you see an increase in libido. You see an increase in desire to have sex, even the enjoyment of sex. And a lot of our patients who come to us will tell me, I don't have a problem with erections, with the mechanical erection. It's a problem of desire. And a lot of times it does help with this, but desire has more than just hormones. For men, it's a little easier. You give them testosterone, you see an increase in desire, they want to engage more. For women, you'll see that, but there's psychological issues, there's couple issues, there's social issues, financial issues that all do it. But in general, I tend to see with my guys, you see an increase in libido. Now, do you see an increase in strength and reliability of erections? It depends. Sometimes you do, but sometimes you get patients that get all the benefits of testosterone replacement. They get the brain benefits, the body benefits, the lean muscle mass, they lose body fat, but they're still having problems with erection. Erection are not always fixed by testosterone replacement therapy, and many times it's not. There may be more issues with vascular origin and neuropathic origin if they have long-standing diabetes. If they have one common cause of it is venous reflux. So if a patient has venous leakage, a patient has venous leakage, testosterone is not going to fix this. What I do with my patients, I said, we have enough treatment modalities that can help erection. I coined a term called SPREAD, sexual performance-related anxiety and depression. And I see many, many patients with this because they have poor reliability of sexual performance or stamina. Now they develop anxiety, depression, even their couple relations changes. And I tell them, don't let that happen. If it's testosterone, we'll start with testosterone. But then I have a plan in my practice where we go down by stages. If testosterone doesn't work, then we add nitric oxide. That doesn't work, then we add microdosing daily Cialis. That doesn't work, then we can go into shockwave therapy. Then we can go into considering maybe a lysosome injection, stem cell injection. So all of this are worth trying it. And I have a few patients I even referred to get a penile implant. Because you know why? If I cannot fix you with all of those things, there is something that can help you fix. It is not worth suffering from shame, from anxiety and depression, because you cannot have reliable erections and satisfy your partner. So whichever stage that you need to fix this, find a way to fix it. We got a lot of patients who use Trimix. Yeah. Yes, it's not the best thing to use, but if that's what you need to have a satisfying relationship in your couple, it is worth doing.
If you found this video helpful, don't forget to watch our other videos on topics around HRT and TRT, and don't forget to subscribe to the channel. And until next time, stay in good health. This is Mike from Balance My Hormones.